interpretation of FVC and FEV1 and FEV1%. So your FVC, which is your forced vital capacity, is a total volume of air that can be forcefully exhaled from the lungs after taking the deepest breath possible. A normal range for an FVC would be 80% or greater than predicted. But if you have a low FVC, which would be under 80%, it suggests restrictions, meaning your lungs can't fully expand. FEV1, which is your forced expiratory volume in 1 second, that's when you take that biggest, deepest breath, you try to force it out, and that push of your exhaled breath in 1 second is what that measures. So a low FEV1 indicates airflow limitation, common in both obstructive and restrictive diseases. Now, again, remember, anything under 80% is low. FEV1% is a ratio of FEV1 and FVC, percentage of the total air capacity, which is your FVC, that is exhaled in the first second. This is the most important parameter to identify obstruction. So if you have anything lower, if your FEV1 or FEV1% is lower than 70%, it could indicate obstructive airway disease. Now, if you get a normal or a high FEV1, FEVC, it can indicate potential restriction when taken with an FVC or a normal lung. Identifying restrictive and obstructive diseases. So for an obstructive disease, such as like COPD, asthma, emphysema, chronic bronchitis, an FEV1 FEVC ratio is lower than 70%, indicating difficulty emptying lungs. Your FEV1 is significantly decreased, your FVC is normal or decreased, and then once again, common diseases, asthma, COPD, emphysema, and chronic bronchitis. And if you have a restrictive lung disease, your FVC is low, so it would be under 80% predicted. Your FEV1 FEVC ratio can either show up as normal or high. And then your total lung capacity, which is your TLC, can be low, and it has to be under the 80% predicted. But you could also have like a mixture of both. So your FVC and FEV1 ratio can both be reduced. And then this is just a chart that I found that kind of signifies and may make it a little bit easier to explain. For like an obstructive, that could be normal or decrease, which is what the pointed down arrows mean. FEVC and FEV1% would be decreased for an obstructive. And then your total lung capacity and your residual volume would be increased, just because obstructive patients cannot push out or empty their lungs like normal people can. So they retain a lot of that air in their lungs. And then with restrictive, it's the opposite. Their lungs just can't expand enough to get that air in. What determines severity? Comparing a patient's FEV1 to predicted normal values, usually expressed as a percentage to determine obstruction. Obstructive, so for an obstructive patient, FEV1 predicted being decreased is what determines the severity of the disease. And then I have the GOLD criteria for severity of COPD. So if you are in a stage 1, which is a mild COPD diagnosis, your FEV1 should be anywhere between 80 to 100 of predicted. If you advance to a stage 2, which is a moderate, your FEV1 should be anywhere between 50 to 79 of predicted. For stage 3, which is severe, your FEV1 is anywhere between 30 to 49 as predicted. Your stage 4, which is very severe and the worst of them all, is your FEV1 can be either under 30% or at least under 50 with right heart failure to be categorized as very severe. And then this is them, like their lungs are just no longer functioning as properly. For restrictive, FVC is what is determined as severity. If it is decreased, this suggests that the patient has a restriction in their lung volumes, which is common in pulmonary fibrosis. So, pulmonary fibrosis is a disease that almost kind of encapsulates the alveoli and forms a layer over them. So, their oxygen and carbon dioxide isn't able to be uh, permeable, so it won't go through both the layers to try to, COPD goes out and oxygen goes into the blood. So they're not able to transfuse in between each other. So it just makes it harder for patients with restricted. Your FEV1 and FEC ratio, a low ratio of under 70, confirming an obstructive impairment used alongside an FEV1 to diagnose severity. Your DLCO, measures how well oxygen transfers through the bloodstream. Lower values indicate worse gas exchange. Okay, so quality control for volume calibration requirement. Daily verification of accuracy using a 3L liter syringe to ensure the device is within plus or minus 0.050 liters of the expected volume. Standards are set by the American Thoracic Society and the European Respiratory Society to maintain accuracy and reliability. So, this is what a 3 liter syringe looks like. It's pretty big, um, and then must be performed daily. Verification technique is using a 3 liter calibration syringe to inject air into the spirometer at a different flow rate, low, medium, and high, to cover the range of zero point 0.5 to 12.0 liters per second. If you get a failed calibration, it just means you have to check fails, which means outside the acceptable limits. The spirometer must be recalibrated. If it cannot be recalibrated, it must be taken out of service and then sent out to get inspected and fixed. Environmental factors. If the ambient temperature changes by more than 2 Celsius, a new calibration must be performed before testing. And all these are just done to ensure that you have the correct and most reliable results to be able to assess and diagnose your patient as accurately as possible.